I am Dr. Laura Moreno, and in this video, I want to talk directly to people living with diabetes and to those who care for them about emergency warning signs, the kind of signals that mean you should not wait, you should not try to manage things at home, and you should not assume it will pass. Diabetes is a condition that can usually be managed day to day, but when certain warning signs appear, the situation can become dangerous very quickly. One of the biggest risks in diabetes is not the diagnosis itself, but delaying action when the body is clearly asking for urgent help. Many emergencies happen because people underestimate symptoms, try to push through, or assume they can fix things on their own. Knowing when to go to the emergency room can truly save your life. One major emergency warning sign is very high blood sugar combined with symptoms. This may show up as extreme thirst, very frequent urination, dry mouth, and a feeling that no amount of water helps. When blood sugar rises too high, the body becomes severely dehydrated and organs begin to suffer. Another critical sign is persistent nausea and vomiting. Occasional nausea can happen for many reasons, but repeated vomiting in someone with diabetes is dangerous. It can quickly lead to dehydration, electrolyte imbalance, and inability to keep medications or fluids down. This is not something to manage at home. Severe abdominal pain is another red flag. This pain may be constant, intense, or worsening, and it often comes with nausea, vomiting, or rapid breathing. Abdominal pain in diabetes can signal serious metabolic problems that require immediate medical care. Rapid, deep breathing, or shortness of breath is another emergency sign. This breathing may feel labored, fast, or unusually deep even when you are resting. It can feel like you cannot catch your breath. This is not anxiety breathing. It is the body trying to correct a dangerous chemical imbalance. A fruity or acetone-like smell on the breath is another warning sign that should never be ignored. This smell can appear when the body is breaking down fat rapidly instead of using glucose properly. When combined with high blood sugar and other symptoms, this is a medical emergency. Confusion, difficulty concentrating, or unusual behavior is another serious signal. This may look like disorientation, trouble answering simple questions, acting strangely, or not making sense when speaking. Changes in mental status mean the brain is not getting what it needs, and this requires immediate evaluation. Extreme fatigue or weakness that comes on suddenly is also concerning. This is not normal tiredness. It can feel like your body is shutting down, your muscles are heavy, or you cannot stay upright. When weakness is sudden or severe, it should not be ignored. Low blood sugar can also be life-threatening and requires urgent action. Symptoms like shaking, sweating, dizziness, confusion, blurred vision, or sudden intense hunger can escalate quickly. If low blood sugar does not improve rapidly with treatment, or if the person becomes confused or unconscious, emergency care is needed. Loss of consciousness or fainting is always an emergency. Passing out, even briefly, is not something to wait and see about, especially in someone with diabetes. It can signal dangerously low or high blood sugar or other serious complications. Another emergency warning sign is chest pain or pressure. People with diabetes are at higher risk for heart problems, and heart attack symptoms can be subtle. Chest discomfort, pressure, shortness of breath, nausea, or pain spreading to the arm, jaw, or back should always be treated as an emergency. One of the most dangerous mistakes people with diabetes make is assuming symptoms are just my sugar being off and waiting to correct it later. Emergencies often escalate faster than expected. Another common mistake is trying to sleep it off. Going to sleep when blood sugar is very high or very low can be extremely dangerous. Symptoms can worsen rapidly during sleep. It's also important to understand that infections can trigger diabetic emergencies. Fever, chills, persistent cough, painful urination, or wounds that look red, swollen, or infected can all push blood sugar out of control and lead to emergency situations. Dehydration is a major contributor to diabetic emergencies. If you cannot keep fluids down, are urinating very little, or feel extremely dry and weak, this is not the time to wait. People sometimes avoid the emergency room because they fear being judged, blamed, or told they did something wrong. Medical emergencies are not about blame. They are about safety and stabilization. Going to the emergency room does not mean you failed. It means you recognized danger and acted. Another reason people delay is because symptoms come and go. Intermittent symptoms can still indicate a serious problem. Improvement does not mean resolution. Emergency warning signs are especially important for people who live alone. If you feel confused, very weak, or unwell, calling for help early is critical. Caregivers should also know these signs. If someone with diabetes seems unusually sleepy, confused, sick, or unable to care for themselves, trust that instinct and seek help. The body gives clear signals when things are no longer safe. Ignoring them can lead to severe complications. Knowing these warning signs is not meant to create fear. It is meant to create readiness. When you know what requires urgent care, you can act quickly, calmly, and confidently. And as you continue learning to recognize how your body signals danger, you build the ability to respond early, protect yourself, and reduce the risk of severe complications while continuing to understand when home management is enough and when it is time to seek immediate medical help. And that ability to tell the difference between a situation you can manage at home and one that requires urgent care is one of the most important skills for anyone living with diabetes. Many emergencies don't begin suddenly at full intensity. They begin with warning signs that escalate when they are ignored or minimized. Another emergency signal that deserves attention is persistent high blood sugar that does not respond to your usual correction methods. If you are taking your medication or insulin as prescribed, drinking fluids, and still seeing very high readings that do not come down, this is not a situation to manage alone. Ongoing hyperglycemia puts enormous stress on the body. Severe dehydration is another critical sign. Dry skin, cracked lips, very dark urine, urinating much less than usual, dizziness when standing, or a racing heart can all indicate that the body is running dangerously low on fluids. In diabetes, dehydration can worsen blood sugar levels and quickly lead to emergency conditions. Another warning sign is swelling, redness, warmth, or pain in one area of the body, especially the legs, feet, or around a wound. Infections can progress faster in people with diabetes, and what looks minor at first can become serious quickly. If there is fever, spreading redness, or increasing pain, urgent evaluation is needed. Sudden vision changes are also a red flag. Blurred vision, double vision, or loss of vision that comes on quickly can be related to extreme blood sugar changes or other serious complications. Vision symptoms that appear suddenly should never be ignored. Severe headache combined with confusion, weakness, or vision changes can also signal a medical emergency. While headaches are common, a headache that is intense, unusual, or accompanied by neurological symptoms requires immediate attention. Another emergency sign is seizures. Any seizure activity in someone with diabetes is an emergency and requires immediate medical care. Seizures can occur with severe low blood sugar or other metabolic disturbances. Persistent diarrhea, especially when combined with weakness or dehydration, can also become dangerous. Fluid loss affects blood sugar control and electrolyte balance. If diarrhea is severe or ongoing, emergency care may be necessary. Another often missed warning sign is severe leg pain, swelling, or sudden warmth in one leg. People with diabetes have an increased risk of circulation problems, and sudden changes in one limb should be evaluated urgently. It's also important to mention that emotional or mental changes can be emergency signals. Extreme irritability, agitation, confusion, or sudden mood changes can reflect dangerous blood sugar levels affecting the brain. People sometimes assume that if they are still conscious, they are safe. This is not always true. Many dangerous conditions progress while the person is still awake and talking. If you ever feel that something is wrong but you can't clearly explain why, that instinct matters. The body often senses danger before the mind can label it. Emergency care exists to stabilize situations before they become life-threatening. Seeking help early often prevents complications and shortens recovery time. Another important point is that emergency symptoms can look different from person to person. What matters is deviation from your normal pattern. If something feels significantly different or more intense than usual, that change matters. People with long-standing diabetes sometimes become desensitized to symptoms. They may not feel lows or highs as clearly. This makes regular awareness and caution even more important. Care plans should always include an emergency plan. Knowing when to call for help, who to contact, and what symptoms require immediate care removes hesitation in critical moments. There is no reward for waiting. There is no benefit to seeing how bad it gets. Acting early is always safer. Emergency rooms are not only for dramatic collapse, they are for situations where the body is no longer able to maintain balance on its own. The goal of knowing emergency warning signs is not to live in constant fear, but to live with preparedness. Preparedness reduces panic. Panic delays action. When you know what signals mean, go now, you don't waste time questioning yourself. And as you continue learning how diabetes affects the body in urgent situations, you strengthen your ability to protect yourself and those you care about, responding decisively when the body clearly signals that it needs immediate support rather than waiting for a crisis to fully unfold. And that decisiveness can make all the difference, because diabetic emergencies often escalate faster than people expect. What feels manageable in one moment can become dangerous in the next. This is why recognizing early escalation signs is so important. Another critical warning sign is persistent vomiting or diarrhea combined with rising or falling blood sugar. Even if blood sugar numbers don't seem extreme at first, the inability to keep fluids or food down quickly destabilizes the body. Dehydration, electrolyte imbalance, and medication disruption can turn a mild issue into an emergency within hours. Another emergency signal is a sudden drop in urine output. If you notice that you are urinating much less than usual despite drinking fluids, or your urine is very dark and concentrated, this can signal significant dehydration or kidney stress. In people with diabetes, kidney function is especially vulnerable. Sudden swelling of the face, lips, tongue, or throat is also an emergency sign. This can indicate a severe allergic reaction to medication or another trigger and requires immediate care, especially if breathing feels difficult or the voice changes. Another red flag is severe leg or foot pain combined with redness, warmth, or open sores. Diabetic foot complications can worsen quickly due to impaired circulation and reduced sensation. Pain, even if mild, should not be ignored when it appears suddenly or progresses. Some people experience extreme hunger combined with shaking, sweating, confusion, or weakness. This often signals dangerously low blood sugar. If these symptoms do not improve quickly after treatment, or if the person becomes confused or drowsy, emergency care is needed. Another important emergency sign is persistent confusion or inability to wake fully. Excessive sleepiness, difficulty staying awake, or trouble responding appropriately are not normal and suggest the brain is under metabolic stress. Rapid heartbeat combined with weakness, dizziness, or shortness of breath is another signal that the body is struggling to maintain balance. This can occur with both high and low blood sugar states. It's also important to mention that illnesses such as flu, stomach viruses, or infections can dramatically alter blood sugar control. During illness, thresholds for seeking emergency care should be lower, not higher. People sometimes avoid emergency care because they fear cost, inconvenience, or being told they overreacted. But emergencies are defined by risk, not by outcome. Acting early is a form of prevention. Another common mistake is relying solely on glucose numbers without paying attention to symptoms. Numbers matter, but how you feel matters just as much. Severe symptoms with not that bad numbers still require attention. Some emergencies happen overnight. Waking up confused, drenched in sweat, severely weak, or nauseated is not something to ignore or sleep through. Living alone increases risk. If you live alone and feel suddenly unwell, calling for help sooner rather than later is critical. Caregivers should trust their observations. If someone with diabetes is not acting like themselves, appears confused, very ill, or unable to manage basic tasks, that is enough reason to seek urgent care. Emergency warning signs are not punishments for imperfect control. They are biological signals that the system is overwhelmed. Knowing these signs allows you to act without shame or hesitation. Diabetes requires daily management, but emergencies require immediate action. The difference between recovery and complication is often measured in time. And as you continue to build awareness of how your body signals danger, you strengthen your ability to respond promptly, reduce risk, and protect your health in moments when quick action matters most, while continuing to develop confidence in knowing when home care is enough and when it is time to seek urgent professional help without delay. And that confidence in knowing when to seek help is something that often develops only after people experience a scare. But it doesn't have to be that way. Awareness can prevent those moments from turning into crises. Another important emergency sign is a sudden inability to think clearly or make decisions. This may show up as trouble following conversations, answering simple questions, or performing routine tasks. This is especially dangerous because the person affected may not realize how impaired they are. When judgment is affected, waiting becomes more likely, which increases risk. Another red flag is sudden loss of coordination. Stumbling, clumsiness, difficulty standing, or feeling unsteady can all signal that the brain is not receiving adequate glucose or is affected by severe metabolic imbalance. These symptoms are not just being tired. Unusual sleepiness that is hard to interrupt is also concerning. Falling asleep unexpectedly, being difficult to wake, or drifting in and out of awareness are signs that require immediate evaluation. Some people experience intense headaches that are different from their usual headaches. When headaches are severe, sudden, or accompanied by confusion, vision changes, or nausea, they should be treated as an emergency. Another warning sign is persistent chest discomfort that may not feel like classic pain. Pressure, tightness, or heaviness in the chest, especially when combined with nausea, sweating, or shortness of breath, is particularly concerning in people with diabetes because of the increased risk of heart disease. Severe low blood sugar that requires assistance from another person is always an emergency. If someone cannot safely treat themselves, cannot swallow, or loses consciousness, emergency services should be contacted immediately. Another subtle but serious sign is worsening swelling in the legs, feet, or face over a short period of time. This can indicate fluid imbalance or strain on the heart or kidneys. People with diabetes may also experience silent emergencies. Reduced pain sensation means serious conditions can progress without strong warning signals. This makes paying attention to changes in behavior, energy, and mental clarity even more important. Another factor that increases risk is dehydration during hot weather. Heat increases fluid loss, and people with diabetes may not feel thirst normally. Heat-related dehydration can quickly destabilize blood sugar and circulation. Some emergencies are triggered by missed medications or dosing errors. If this happens and symptoms appear, it's important to seek help rather than trying to correct large errors at home. It's also important to know that emergency departments are equipped to stabilize blood sugar, fluids, and electrolytes quickly. Seeking care early often leads to faster recovery and shorter stays. Shame, guilt, or fear of judgment should never delay care. Emergencies are not moral failures, they are physiological events. Planning ahead reduces hesitation. Knowing which symptoms mean call now removes doubt in stressful moments. Emergency contact numbers, medication lists, and medical information should be easily accessible. This preparation can make a critical difference. Education empowers action. Action saves lives. Diabetes management is about balance, but emergencies are about urgency. Listening to your body, trusting changes that feel serious, and acting promptly are not overreactions. They are protective behaviors. And as you continue to build this awareness, you reinforce a sense of readiness rather than fear, allowing you to live with diabetes more safely and confidently, knowing that when the body signals danger, you will recognize it and respond without delay, continuing to strengthen your ability to protect your health in moments when time truly matters. Subscribe to the channel and turn on the notification bell so you don't miss future videos where we talk about diabetes and health in a clear, calm, and practical way. Share this video with someone who lives with diabetes or cares for someone who does. Leave your questions or experiences in the comments, and join me as we continue learning how to recognize emergency warning signs early and act in time to protect life and long-term health.